How does one go from fleeing a civil war to becoming special assistant to the President of the United States? What do a wedding, an oxygen tank, and a self-starter mindset have in common? The Honorable Dr. Raj Panjabi, former Special Assistant to the President and Senior Director of Global Health Security at the National Security Council, answers these questions and more. I'm your host, Hadeil Ali. Welcome to Driving Impact.
Driving Impact, an exclusive insight into the personal backgrounds and careers of trailblazers on the front lines of policy.
Good morning, Dr. Panjabi. Thank you so much for being here.
Good morning, Hadeil. Nice to be here with you.
How are you doing today?
I'm great.
I have to tell you that I am so incredibly excited for our conversation today. I've been looking forward to it for months, and your story is just so incredibly moving. So thank you for taking the time to share that with us today.
Thank you. It's good to be here.
Yeah. Is it okay if I use Raj throughout the interview? Is okay?
Yeah.
Okay, make it a little bit more casual. So Raj, tell me, what did 10-year-old Raj Panjabi want to be when he grew up?
On the World Cup as a soccer star, or in the World Cup as a soccer star, which is now my 11-year-old's dream, which he's selected himself. But I was actually had just come here to the United States after fleeing civil war in Liberia, where I had grown up. And that was my 10-year-old dream. But by the time I was 11 and 12, I had actually given up on soccer, and basketball became my thing. So I very much...
Still sports, but
still sports. Yeah, I was the kind of kid that had as enough Michael Jordan posters on the wall that you could barely see much of the paint.
Oh, wow.
So that was the kind of hope I had, but it was too short and too unathletic overall. But I like to say the science and math saved me, and ended up going into medicine.
You know what's funny, Raj? I was actually in Qatar, where the World Cup happened just this past year in December. My parents lived there, so I got to go and be there. My dad went to quite a few games as well, so that was really cool. So you said it changed pretty quickly, and you were pretty good at science and math. Was there any influence from your family, or did they push you towards the sciences, or were you just really good at it?
Well, I think there was some influence from my family. My mother was a lab technician in India before she met my father in the 70s and got married to him, and then they moved to West Africa. And she was a math teacher in West Africa with part of her time. She'd tutor kids in the afternoon, and I'd be sitting at the dining table, and my mother is very loving and also very strict, especially at that time. And I know when she came here to this country, to the U.S., because we'd fled civil war, we had lost, so much, and she wanted to continue to pursue her dream as a lab scientist, but couldn't afford both that and making sure we had all our needs met. And so I do think that is a part of it. But my parents have also been, one works in a clothing shop, the other now is a photographer. They're both entrepreneurs, and I think in like most entrepreneurial families, they prize creativity and self-direction. And so my parents have been very open about what path I choose. But certainly I think from a childhood I admired scientists because my mother was very much one.
Yeah, absolutely. So I know, Raj, you've mentioned a little bit your story here, but could you walk us through, when you read your story, we see Mumbai, there is Liberia, and then North Carolina. What was that journey like?
Well, it really starts with my grandparents. They lived over 75 years ago in an area now called Sindh, and was then called Sindh as well. Sindh is now a province in what's now Pakistan, but at the time was all part of India. And about 100 years of British colonial rule led up to the partition of India at that time. And my grandparents on both sides, my mother and my father's side, were Hindus, which were about 1% of the population in a largely Muslim and some Sikh community in Sindh. When partition happened in 1947, my grandparents had to flee. They fled on a boat to Mumbai. They became essentially refugees. And because our people were actually living in a part of the subcontinent that had been considered an area where Muslims, Sikhs, and Hindus were quite tolerant, very multicultural, in fact. That was up until colonialism, I think, damaged so much of that multiculturalism. There was an assumption that our people wouldn't need a land in India. In fact, our people were not given any homeland. Punjabis were given homeland in India. Others were given, those who had to flee from what became Pakistan. But our people were not Sindhis, Hindu Sindhis. But what we did have was connections to many other parts of the world. And my grandparents and my father and his brother and two brothers were, in fact, part of this network of men, largely during the time of colonialism, who had been, in some ways, leveraged by the British to be merchants, to be part of the administrative staff across the British Empire. So it stretched from, places in the Caribbean all the way to the Far East, but included places like West Africa. So a generation after my grandparents had sort of started from scratch, their kids, my father, his brother, his two younger brothers, started to seek employment elsewhere, outside, where there was connection. And so my dad's younger brother had found a job in Liberia in West Africa. It's where my father moved, and in the 1970s. And several years later, he would meet my mother, and then they would both move to Liberia together. And I was born there in Liberia in West Africa. Lived a pretty normal childhood, I mean, one that any child would dream of. But my father has this saying he learned from a West African novel, no condition is permanent. You can't take the ones you have for granted, and the ones that where you suffer may be things that could transform in the future. Well, when I was 8 years old, on Christmas Eve in 1989, civil war erupted in Liberia. And that sent my family and thousands of others into a crisis.
And afterwards, that's where your family finds themselves in North Carolina.
Yeah, our journey from Liberia to North Carolina really had to do with the Civil War. Within a few months of Christmas Eve 1989, so by the spring of 1990, rebels had surrounded our hometown, Monrovia, and my parents' shop was shut down, our school closed. My father was involved in trying to help evacuate people all of a sudden. My mother came knocking one morning. I remember her saying, "Raj, pack your things, we have to go." And my father drove us to this airfield in the middle of town. The international airport had just been attacked and overtaken by the rebel army. So there was no way to flee through normal commercial flights. And so my father drove us to the middle of town in a van, and my mother, sister, and I were stuffed into the cargo compartment of a military rescue plane. There was a bench there. Our luggage was right in front of us where the luggage compartment was, with a net thrown over it. It was hot. It was sweaty. And we were sweaty. My heart was racing. And I remember just looking out the window. My sister and I had our faces pressed against the window to take one last look at my father. And we took off. He stayed behind to help evacuate other people. In the daytime, at night, he would be sleeping on the floor of his apartment with his friends, sleeping on the floor because bullets would whiz by the windows, and he wanted to avoid getting hit. So it was a very difficult time for him, difficult time for my mother and my sister and me. we ended up becoming refugees in Sierra Leone for several weeks, and then were resettled in North Carolina. One of my family's friends, a host family, took us in. I remember my mother staying up at night, when she put us to bed. She'd go into the living room and pray for my father. And I remember being a 9-year-old, and at one point we lost touch with him. And so she started a 21-day fast. And she would pray at night for his safety. And on the 21st day of that fast, she got a call from Sierra Leone. It was my father. And he had escaped that morning. He had, in fact, taken his friend to escape, and in a split-second decision had decided to jump on the plane as well. Well, that plane ended up becoming the last plane that would leave Liberia during that time. And I still remember being here in the United States, and as a 9-year-old, my second son is now 9, and I had a body about as little as he has. And I still remember my dad being reunited with him, knocking at the door, picking my little body up and wrapping his arms around me. So that we went on to in North Carolina to try to make a life. But that moment of seeing my parents struggle through conditions that no one would ever wish for anybody's family, I think had a big impact on me as a child here, and gave me a sense of what resilience looked like, what struggle looked like. And then we had to rebuild our lives here as immigrants.
Yeah. I was exactly thinking that, Raj, a story of hardship and struggle, but also a story of resilience that makes an impact on who you are, but also the career choices that you probably made afterwards. You mentioned a host family in North Carolina. Are you guys still in touch?
We are. Yeah, my mother actually still works with one of the family members that took us in High Point, North Carolina. That family helped us in many ways, as a whole community in High Point did. That host family put us up in their 2-bedroom apartment. The 7 of us stayed there at the time, my 4 family members and their 3 at the time. We eventually moved out. They helped us and my parents get into clothing sales. Again, that entrepreneur network that I mentioned earlier of Cindy's around the world. There's Cindy.
Right.
And entrepreneurism, some people say it comes naturally to some people. I think it's born out of creativity, sometimes survival. And so my mother still works in that store, New York Styles, although it's in High Point, North Carolina. My father had a store of the same name. They're all part of the same company that he opened up in Winston-Salem. So I grew up, my parents couldn't afford childcare because of the circumstances the conditions we came under. But that actually exposed me to entrepreneurship because I'd spend the weekends and holidays with my father selling sneakers and jeans and suits. Ironically, at that time, RJR's had a headquarters there, so we would also be selling suits to them and also churchgoers, ironically, because I ended up going into public health. But that was my childhood, and that mixed with a little bit of hip-hop. My dad was selling jeans and sneakers largely to customers who were into hip-hop. And so he had to play his jingles in between Dr. Dre and Snoop Dogg's greatest hits, which, gave me a little bit of
creativity.
Creativity,
But not only hip hop. Were you maybe competing in some form of dance? I've heard. Is that true?
Yeah. Before I became Panjabi MD, I used to dance to Panjabi MC.
No longer?
It depends how if you're watching or not. That's the first time I came to Washington D.C. was as a college student. I was finishing my freshman year, and the woman who would end up becoming my wife, Amisha Raja, and I had a chance to participate in a dance competition.
Oh, wow. Oh, so she's a dancer too.
Oh, yeah.
Oh,
well, that's
wow.
actually mainly part of why I became one. But
okay.
is to,
you were trying to
exactly impress her. I have not quite impressed her ever with my dance moves, but I did end up participating in the Daughters of the American Revolution Hall right on 17th Street is where they were hosting the Bhangra blowout competition, believe it or not. And we thought so much of ourselves that the UNC, University of North Carolina, where I went to college, Bhangra team was called Bhangra Elite. It's still called Bhangra Elite today, even if I can't speak for today's dancers. I certainly was not an elite dancer. But was a big part of my college. And I think, we were talking earlier about third culture kids, the idea, maybe you could say it, describe it again, but it kind of felt like a fit. It felt apt. But go ahead and explain it, because I think it kind of explains why I was into dancing as well.
Yeah, I mean, Raj, I was just thinking about your story and a little bit about mine and this idea of home, right? And sometimes growing up in a certain culture, having parents from a different culture, and then living now in a third culture, what does it mean kind of navigating these? We've had different stories, but I think also similar in some ways. I was mentioning to you, my parents are Egyptian. I grew up most of my life outside of the U.S., born in the U.S., now living in the U.S., and kind of thinking about what does it mean to be, American, having had this multicultural background, and are we leveraging and appreciating the diversity of those backgrounds when we're thinking about careers in international affairs or national security. So always thought of, given your story, when someone asks, where are you from? Is it easy to say, or do you tell them sometimes the story? I'm like, I'm just going to tell you I'm Egyptian American. I don't want to make it very complicated. But you kind of wish, to expand a little bit more on the complexity, of our stories.
Yeah. Well, you and I, and probably many others, third culture kids, I think that is a great way to
and now you have this new term that you can
people.
use moving forward, and you need to credit me for it.
Absolutely.
So, Raj, I want to talk to you a little bit more about some of the work that you've done, and starting with this TED Talk that you did in 2017 that was called "No One Should Die Because They Live Too Far from a Doctor." First, what was it like doing a TED Talk? Were you stressed before?
Oh my gosh, it's one of the most nerve-wracking
Really?
things I've ever done. Yeah.
Wow.
It was fun too.
Yeah.
And transformative in so many ways. Humans are by history natural storytellers, right? A friend of mine, Chris Anderson, who leads TED, wrote a book called How to Give a TED Talk, and he, in his opening, speaks about the 4 R's of that. We have writing, we have reading, we have arithmetic. Those 3 R's, obviously, they may start with different letters, but have a similar sound as an R. Are literacies we take as commonplace. They're things that we ensure our kids strive for. Rhetorical literacy, the 4th R, is something Chris and the whole TED community, I think, it's why I think their platform's so popular. The idea of helping anyone from children to grandparents have a chance to tell a story. So for me, being a physician, you're always listening to stories of patients.
People's personal stories.
It's one of the reasons I went into medicine, or at least have kept connected to it all these years. That's one of the most gratifying parts, is to listen to someone often in their most vulnerable moments. And the chance to give a TED Talk, to tell a story, was important. Having a chance to tell it about the more than 1 billion people who live out of reach of care is around the world is something that was a privilege. And then, so that's why the talk was titled "No One Should Live Too Far. No one should die because they live too far from a doctor." Because I actually have seen in my own career too many people die because they live too far from healthcare. And that's because I ended up going back to Liberia when I was a 24-year-old medical and public health student in 2005, and saw a country that had been, after so many years of civil war, had been left with 51 doctors for a country of 4 million people. Those are big numbers. If to try to relate to them a little bit, I often say it'd be like Washington, D.C. having about 8 to 10 doctors. Imagine the whole city of our nation's capital having only 8 to 10 doctors to care for all the people in this metropolis. It'd be impossible. In Liberia, things were even harder because if you lived where those doctors were, almost exclusively in the city I grew up in, Monrovia, you might stand a chance. But if you lived in rural areas where no doctors existed virtually, you'd often die from conditions that no one should die from in the 21st century. Complications of childbirth, a pneumonia when you're a child, malaria, which was about half the kids get infected. Half the clinic visits were for malaria. I had malaria as a child there, and it still infects so many people around the world. So, of course, to stop those deaths, we have to bring care to people, not wait for people to come to care. And I found that community residents, people without a medical degree, people without a nursing degree, often without a high school degree, could be an important part of extending the reach of doctors and nurses to places that otherwise wouldn't reach. And so that's what that TED Talk's about. It's a gloomy title, or at least a morally focused one. No one should die in the 21st century because they live too far from healthcare. No patient should be out of reach. And that's, ended up being part of the reason we, myself and others who had returned from the Civil War, my wife, classmates in public health and medicine here got together to start a nonprofit organization called Last Mile Health with the goal of saving lives in the world's most remote communities in 2007.
And Last Mile Health, how did you first pick the name? I mean, I understand what it's referring to, but did you pick it? Was it your wife?
The original name actually wasn't Last Mile Health. The original name was in a local dialect, and Tiatine Health. And Tiatine is spoken in a dialect in a forest community, a community that has, kind of existed in the rainforests of Liberia, towns and villages and communities. That local word dialect only spoken by 40,000 people. But the essence of the word Tiatine is justice. And that fueled the early values of the organization. But we started, the reason we call it Last Mile Health and ended up calling it that is because we wanted to draw focus to the people around the world who live out of reach of healthcare because they live in rural, remote areas where doctors and health workers may not reach
those areas.
So that ended up being a big focus of the organization. And the word last mile has been used in many ways. The telecom industry uses it when you think about building last mile cell phone communications or last mile electricity or power. In many ways, we do think about it in the physical sense, but a lot of these people are out of reach also because they're facing poverty and they're facing inequities in the way the health systems are built.
Yeah. Your focus was on the healthcare system, like you said, Raj, but it could be applicable to so many other systems as well. So when you started Last Mile Health, you had to raise some money. Did you raise some money during your wedding? Is that true?
It's true. We it comes back to that entrepreneurial spirit and maybe some naivety as well. We thought that the reason we started Last Mile Health wasn't one of these, an idea got popped in our mind and then we went to Africa, right? I grew up there. I was seeing patients in a bombed out hospital. In fact, half of the roof was still off of parts of the hospital. In southeastern Liberia, it's about a 12-hour drive from Monrovia near the border with Côte d'Ivoire in the rainforest. And the government of Liberia had just introduced testing for HIV. I had been seeing patients with HIV who then were dying within weeks or days sometimes because they were out of reach of treatment. Why were they out of reach of treatment?
Right.
Because you had to be a physician to prescribe the medicine. Where were the physicians? The physicians were 12 hours away in the capital. It wasn't a surprise that even in the year 2007, even after HIV treatment had been available to many people around the world and was being decentralized, Liberia, because of the lack of health workers in rural areas, had not been able to decentralize it. So in February 2007, we worked with the government. I was actually still volunteering with the government as a clinician in that hospital. Took an F-150 truck and brought a pickup full of antiretroviral medicines. And the next day, February 2nd, 2007, we launched a clinic in the hospital. We didn't have space for it. So we actually ended up, we're given the bathroom, actually the bathroom and closet. And in that washroom is where we set up a desk and started seeing patients and started enrolling them on HIV treatment. And although we lost still too many, I'm proud that some of them not only are still living, but became part of what would become Last Mile Health. Right. But the challenge, of course, was that many of these people were coming from rural, remote communities, still hours away. How do we get healthcare to those people? How do we test them earlier? How do we treat them and keep them on treatment? How do we deal with not just their medication needs, but their social needs? Many were suffering from malnutrition or didn't have a job, or were spending the equivalent of half a year's of income just to get one way to the hospital.
Yeah. And these issues, Raj, you've obviously worked on them with Last Mile Health across the African continent, but you've also worked on these same issues in the U.S., working on in rural Alaska, in North Carolina,
right.
These issues of, again, lack of access, right?
Right. Yeah, so coming back to, in fact, it was the work in Alaska that I had, it's my first job in public health, was working on the Yukon River Delta in 2001 with the Yukon Kuskokwim Health Corporation. So here we were on the Yukon River Delta trying to get healthcare to thousands, tens of thousands of Alaska natives who had designed a system over 50 years of hiring, training, and equipping local people, often women, but men as well, as so-called community health aides. Again, trained for 16 to 32 weeks. You may just have a 10th grade education, but then you become an extended part of the medical team. And so supervised by nurses, remotely supported at that time with telemedicine by doctors. And they had figured out over 50 years to provide dental care to their neighbors, to provide vaccines, to provide primary health care. We were, and that model in my mind had the idea of answering the call to serve your neighbors being the basic principle was something that I think really influenced us. And the work of organizations like Partners in Health, who had done work to roll out HIV treatment, engaging community health workers, influenced us. And between February and May of June of 2007, when we got married, my wife and I, because you brought up the wedding and Last Mile Health, we had enrolled about 60 patients in HIV treatment. It was the first HIV clinic site in a rural part of the country in the public sector. But we had no way to provide support to them to bring their medications. We could enroll them in the hospital and go back hours or days away into their remote rural communities. So to solve for that, we wanted to hire, train, and equip people from those communities to be part of the medical team, since the health worker shortage, which still plagues many people around the world, many communities, is a problem. Well, look, we didn't have a plan, you could tell, because the only way we could raise money was to ask our guests
at your wedding,
who were largely, let's be clear, medical students and public health students. Last time I checked, neither of which are the most wealthiest people on the planet.
But they were supportive.
But they're very generous. Yeah. And we ended up raising $6,000 and enough to fund about 30 community health workers for 1 year in one community. But today, Last Mile Health is working with several governments across Africa, both during the history's worst Ebola outbreak in Liberia, but then during the COVID pandemic across Africa, to hire, train, and equip thousands of health workers, like community health workers, to serve millions of people who otherwise would be out of reach of the care they need. And so I feel very proud about the work my colleagues there continue to do, grateful for the many who stand with Last Mile Health to keep doing that work, including our partner countries.
Yeah. So Raj, as you know, we ask our guests to bring a memento, something that represents a meaningful moment in their career. Could you please describe to us what you brought here today and what it represents to you?
Well, I brought my stethoscope, and what it represents to me is how important it is to listen to those on the front lines of any problem. I've worked in public health all of my career. I also have worked in national security. I just recently completed my service at the White House National Security Council and working as the special assistant to President Biden and senior director for on the National Security Council, focused on the mission of protecting America and the world from pandemic and biological threats during COVID and a number of other epidemics. And so sitting in that building in a classified office so many hours of every week, I think got me reflecting on how effective policy is made. Yeah. And for me, I've seen that those who are able to be most proximal to those who may be impacted by our policies ended up being the most effective decision makers. For in medicine and public health, for me, that practice has been seeing patients. It was why I felt so confident as a then 25-year-old working with the Ministry of Health to launch a HIV treatment clinic, because I was seeing patients with tuberculosis with the stethoscope and listening to their lungs dying. It was it's what's during the beginning of the COVID pandemic in the United States, although we were supporting work in Africa, I put my hand up, as so many of my colleagues did, to volunteer to work in testing clinics in Boston, and then work in vaccination rollout sites, even as part of the president's and the White House's and the government's work to roll out hundreds of millions of vaccines in this country. So to me, that has been, the most symbolic of how proximity in policymaking involves listening, because you put on your stethoscope around your ears and then you put the other end of it on a patient's chest, and how humbling that can be, because often if you're investing in the people closest to the problem, you're often seeing your policies not work as effectively as you think they might be.
And that's sometimes often the challenge, right? There are policy being made at a high level, right? And maybe those folks not having that experience or understanding of what happens on the ground. And I think about your story and the importance of having someone like you, who was the special assistant to President Biden, but is also the person that founded Last Mile Health, and also the person that worked in communities in rural Alaska, and how that's so powerful in the policies that you end up creating.
I think those are experiences I keep coming back to, as far back as seeing, when I was 24 and first gotten back to Liberia, I was caring for a 7-day-old newborn girl with my stethoscope.
This same one?
Not the same one, but it would be infection prevention and control malpractice if I had kept it all those years. But very much like this one. And she was the first patient that I cared for that was extremely sick. Her mother had given birth to her in a community 8 hours from the clinic in northern Liberia. And she'd noticed her child was sick because it wasn't her first child, and her child was having difficulty latching onto her nipple and her breast to breastfeed. But she was stuck because she was in a forest community that required her to walk, again, 8 hours to the nearest clinic, because that's where the nearest health worker was. And I happened to be part of that team of health workers when she eventually was able to get, after all those hours of walking, her daughter to the care that she needed. And I remember holding this little girl in the one-room emergency room, putting my stethoscope on her lungs, and the only way I can describe it, because it's hard to describe the sounds of lungs being eaten up by bacteria. She had a pneumonia. It was clear. Is imagine the sound of choking car engines. So we knew what was wrong. We had antibiotics. What we were missing was oxygen. The only place an oxygen tank existed was in the neighboring building, and it was the only oxygen tank in the entire county or state, you could call it, medical oxygen. And that oxygen tank was reserved for what? For providing oxygen to mothers who needed to undergo a C-section to bring babies into the world. So we negotiated with the operating room staff if we could pick up the tank and bring it to the pediatric ward to put oxygen on this little girl. After some back and forth, they allowed us. So 4 or 5 of us picked the tank up and brought it over and put this little girl on oxygen. You can immediately see her. So many of us have either lived through it, now seen a relative, or have seen the images during COVID of suffocating when you have a viral infection, and how devastating that is. Imagine a 7-day-old who was then alleviated from her distress. But by 2 a.m. that night, a mother did have to come in, did need a C-section. That oxygen tank was needed for her. And so that tank was pulled from 7-day-old to be given to the mother who was bringing a newborn in. And she ended up delivering a healthy baby girl, but the one we were caring for died. So for me, this stethoscope, and anyone that wears one or has other tools that bring them close to the people we're trying to serve, but also remind us how far we are from the stated policy goals of health equity, of health security. What does that mean? Keeping all people safe from the diseases that impact our lives, that shorten our lives. We're far from that. And I think that, but we've made significant progress as well. And I think that, to me, is why the stethoscope was the momentum that you asked me to. I have to say, I'm very impressed with Dwayne and his setup here. This is not, just for the record, the way I keep my stethoscope at home, but it is very impressive. Perhaps doctors should keep it that way, but I'm very impressed that you stabilized it.
Thank you for sharing this powerful story. It reminds me of this quote that I've seen you use before: illness is universal, but access to care is not, and should not be.
Illness is universal and healthcare isn't, and it's still true.
To this day.
We've made a lot of progress, and we continue to make progress, but the COVID pandemic, set back so much progress. And I'm very proud of the work that we've done with partners around the world.
You were the top pandemic official, right?
I was the top pandemic official for the president of the National Security Council, and so that I came on to the role after serving as the president's malaria coordinator, leading the U.S. president's malaria initiative, which was dealing with the world's oldest pandemic. Malaria is the world's oldest pandemic. And I had grown up having in a country that has malaria. Yeah, as with malaria several times as a kid, like many kids do in Liberia. But then also had seen the power of investing, not just in the products, the new vaccines, the tests, the treatments. We were rolling out the world's first malaria vaccine when I was the head of the President's Malaria Initiative in support of the World Health Organization and countries largely in sub-Saharan Africa. But also the power of investing in people.
The community networks that you talked about.
Yeah, the local
right?
community health workers. And that became essential to help us fight COVID.
Raj, clearly because of everything you've done, you've received so many accolades over the years. I'm not going to list all of them, but just to mention a couple here for our audience and listeners. You're on the Time 100 list of most influential people in the world, and twice one of the world's 50 greatest leaders by Fortune. How does it feel to receive all of these accolades?
Well, no accolade I've ever received is anything but a product of two things. One is the importance of the issue of the day, and the importance of the people that I've been lucky to be surrounded with who are doing work to address that issue. So for me, I mean, look, I lived this as a kid. We can have a myth that people are self-made, but they're really not. People aren't self-made. They're shaped by others. So I think with every one of these, what recognitions, what we've tried to do is to, whatever organization I've been a part of, try to take that as a recognition of the challenge, to be humble that, in fact, often that challenge requires a lot more work. Look at the state of health inequity in the world. And that actually, also, there are a lot of people on the front lines who deserve support to get that work done. One good example is just around the Time 100 recognition in 2016. It really it could have been given to so many other people, but one of the reasons I think we in Last Mile Health were acknowledged is because, like Last Mile Health and many others, were focusing on these local health workers who were critical to keeping not just Liberia safe, but the rest of the world safe. I mean, we were told in the middle of that crisis that 1 million people could become infected in just Liberia, Sierra Leone, and Guinea, that more than half of them would die if nothing more was done. Terrifying. I mean, those three countries, all of us had gone through civil war before. We were still terrified. And this is in 2014. And you'll remember President Obama and Vice President Biden at the time had mobilized the world to bring in more support, which we all appreciated. But it was still terrifying. And I remember standing with local health workers on the front lines in a little structure, a home there's a little church actually in the middle of the rainforest where a woman had just died from Ebola, and about 13 people who had attended her funeral had become infected in the subsequent weeks. And the midwives and the nurses and the community health workers who were learning to put on the gloves, gowns, and masks to both care for patients who may have Ebola and other conditions and keep themselves safe while serving. And I remember seeing the fear in their eyes because at that time, for that strain of Ebola, we didn't have an approved vaccine. So that meant you could become one of the infected victims, and that wasn't a theory. Nearly 10%, 1 out of 10 local health workers in the Ebola epidemic, history's worst Ebola outbreak in West Africa a decade ago, died from Ebola. So you can imagine how fearful these workers were. But I also saw that they were willing to answer the call to serve their neighbors. They worked, nurses and others, to hire, train, and equip thousands. End up being, they think, about 10,000 people around the country to learn the symptoms and signs of Ebola, even if you weren't medically trained, to go door to door to find the sick and get them into care. And within months, brought the Ebola outbreak under control and ended it by frankly risking their own lives, not only to keep their own people safe, but to keep the rest of us safe. So when a media organization like Time, and I've been fortunate to stay in touch with them, acknowledges, as they did that year,
This work, yeah.
their person of the year were actually people of the year, and they were the local health workers. You can't help but feel hopeful that the narrative of change actually is about local people doing work in their own communities. And so to me, that's what we've always tried to do when there's any recognition, is to focus it.
And service, you mentioned, is a big part of what you've done in your career. And I imagine that your story, again, and your family story of, like we said earlier, of hardship and struggle, but resilience is also part of this. I saw you mention that once, this fire that you had in your soul, right, to pursue this line of work, service to communities, and make the world a better place. So Raj, we like to ask our guests 3 questions every episode of Driving Impact. Are you ready?
Sure.
Okay. What are 3 words you would use to describe your career?
The 3 words for me, one is courage. The second is humility. And the third is discipline. And I struggle with all 3 equally, trying to strive for those in my leadership.
What does it mean, in your opinion, to be American?
You know, our President Biden, has a beautiful way to describe it, and it's one that I've found resonates with me: possibility. You know, I came here. My parents went from losing their house in the Civil War to then seeing their son serve in the White House. And
does it feel surreal at any
point?
Yeah.
I mean, it still does, right? Every day I walked into that building, I pinched myself. On the way out, I pinched myself. I also had a very stern picture of General Washington overlooking me, a painting of him my whole time I was there. So it actually got me to reflect a bit on why is it that we can describe this country and what it means to be an American with the word possibility.
Yeah.
And I think it's partly because the people who founded this country, who fought for the freedoms here, like General Washington, the ones who fought for the freedoms like Gandhi, that helped India become the world's largest now democracy. The possibility of a country in Liberia, in West Africa, that could become a place where people of color, black people particularly, at a time when slavery hadn't been abolished in this country, the pursuit, Liberia's symbol, its state symbol says the pursuit of, the love of liberty brought us here. I think that idea of pursuing freedom is what is beautiful about this country. But what's even perhaps more special, speaking as someone who was born an Indian citizen in a country where I could never become one because of the color of my skin. I couldn't become a Liberian citizen because you had to be 1/12 black African descent to be a citizen. To be given the chance in 2011 to become a naturalized citizen is something I can never forget, like so many. As I stood there at the JFK Center in Massachusetts, and it was on the 50th anniversary of JFK's election, hearing the recorded video of President Obama, I was moved to tears because I realized that possibility is yours for any dream you want to pursue in this country, if all you do is agree to the ideas that made this country. And I had never experienced that in my entire life. That all you had to do was believe in what makes this country what it is: freedom, liberty, equality, equal opportunity. And that you're willing to be part of the struggle to pursue those things, and you get to be American. Incredible.
It reminds me of a quote, I don't remember the quote exactly, by James Baldwin. He says something along the lines that, because I love my country so much, I criticize because I want it to be better, right? You want to make the U.S. a better place. Raj, what is giving you hope right now?
You know, to me, the idea that sometimes we can't choose the conditions we face, but we can always choose how we respond to them is something that's, as I mentioned earlier from my dad's reciting of that West African novel, No Condition is Permanent, has been a through line for me. It's still something that gives me hope because I think that that's what it means to be human, is to look in the face of some of the most difficult conditions. And our country, the United States, is facing a lot, our world is facing a lot. But we can still choose how we respond to those conditions. And that gives me still a tremendous amount of hope, even in some of the darkest moments.
Your story, Raj, is such an incredible testament to the fact that diversity of thought, diversity of lived experiences, and lived experiences as expertise, diversity of backgrounds makes our country better, right? Makes the policies, the national security policies, better, more effective, right? Having that understanding of the communities. It's been such an honor to hear your story. It's powerful story, humbling story, a story of resilience. So thank you for taking the time to share that with us.
Thank you, Hadeil. And thank you and the team here for doing this series. I think it's, for all the reasons you just said, so important.
Thank you. And we'll be watching for what you're going to be doing next. Thank you for being here. Thank you for joining our conversation with the Honorable Dr. Raj Panjabi on his lifelong dedication to service and expanding healthcare access around the globe. Do you want to hear more exclusive stories from policy leaders? Be sure to follow Driving Impact on YouTube, Spotify, or CSIS.org.